I want to welcome you to the Doctor's Black Bag lecture series. This is brought to you by the Partnership for Environmental Education and Rural Health. I'm Dr. Dan Posey, and I work at Texas A&M University at the College of Veterinary Medicine and Biomedical Sciences. I'm a clinical associate professor. Today we're going to be talking about diabetes. Our objectives for the day are to be able to relate the history of diabetes, identify the symptoms associated with it, be able to tell the difference between type 1 and type 2 diabetes, prevention and treatment of animals and humans, and explain how high blood glucose is a health hazard. Let's take some basic anatomy associated with insulin production. The pancreas is the organ that produces insulin that controls your blood sugar, and its location on your body is associated with your stomach, and it's right about here. It's really important. Without insulin, then we cannot control our blood sugars, and that was what results in diabetes. So, what is insulin? It's a protein that reduces blood glucose sugar levels. Now, why is that important? Well, as you can think of the last time maybe you ate chocolate cake or a Snickers bar or something that had a high sugar content, and you felt like you had a sugar rush. Insulin is produced to regulate your blood sugar level when you eat those high sugar type foods. If it doesn't happen, and insulin production is either decreased or is ineffective, then what happens is you result in diabetes. So, how does this work? Well, the first thing is you take food, and it causes your blood glucose level to increase. Then what happens is you get your pancreas secretes insulin and regulates that blood glucose level. Let's first go through the history of diabetes. The first known reference to diabetes is associated with it during Egyptian times at 1550 BC. The Greek physician Artius named this disease between 30 and 90 AD. So, during those times when there wasn't any blood testing going on or any of the diagnostic tests that we have today, how did this Greek physician discover this? And it's by recognizing the clinical signs that are really important. And those three clinical signs are frequent urination, excessive thirst, and sweet urine. How did they know that the urine was sweet? Avicenna, a famous Arab physician, described the complications with the disease and how it was progressing. And then the French physician Bouchard recognized the importance of the food intake and diabetes. He made that connection in the 1870s. Now, the important person that actually discovered the cells that actually produce insulin was Paul Langerhans. And of course, the islet of Langerhans is what he named these cells that actually produce insulin in your pancreas. As we move through history, we see that Frederick Banting in the 1920s discovered the connection of diabetes treatment with insulin. What he did is he had dogs that were diabetics that had those clinical signs of increased urination, increased thirst, and high glucose in their urine. And he take normal pancreatic tissue from normal dogs and fed that to diabetic dogs. And he saw that those dogs lived longer. So the connection was between insulin and the management of the disease. So, let's do a quick review of what we've learned so far. What are the symptoms that you see with diabetes? Well, those are, of course, increased urination, increased thirst, and sweet urine. What is insulin? Well, insulin is an hormone that is produced by the pancreas. It's a protein, is what it is. And what does it do? It drives the glucose level down in your blood when you eat meals. Let's take a test. Who is this? I'll give you a hint. It's a movie star. Oh yeah, you all know who she is. That's Halle Berry. How about this one? This might be a little tougher for y'all. This is the first Afro-American Major League Baseball player. That's Jackie Robinson. And of course, finally, most of y'all know this, the Denver quarterback, Jay Cutler. What do they all have in common? Well, they're all diabetics. So this is a disease that's confusing because sometimes we think this is an older person's disease or a really young person's disease. And we see these famous people that have this disease, and it's very, very common in our society. So, this is an important fact that between 2002 and 2005, prescription for diabetes medication increased 100% in kids. These points to ponder is really important, but 8% of our population have some form of diabetes. And the total economic cost to the United States is $174 billion. The number of cases increased to 13.5%, between 2005 and 2007, and it's still increasing today. So why do you think that is? Why do you think the increase in diabetes? Well, some of you might think it's maybe we're testing more people and we're actually increasing the diagnostic testing. Our medical system is much better now than it was during the earlier parts of last century, and maybe that's it. Well, that doesn't explain it all. Then you also could say, well, maybe it's some environmental toxin that kills pancreatic tissue and kills those cells that produce insulin. Well, that might be true on some people, but unfortunately, it doesn't explain it. But what does explain it is diet and exercise. Diabetes is a lifestyle disease. It's associated both with what you eat, how much exercise you get. As you look on the screen there, you can see cakes and milkshakes and pizza and ice cream, all those things that have high carbohydrate content, okay? And so you got to match your caloric intake, what you're eating, with your exercise. And that's the reason that we have such an increase in diabetes today. Now, there's two types of diabetes. And first one on our screen there is type 1 diabetes. So let's go through how it happens and how actually insulin works and how a diabetic actually, type 1 diabetes affects the body. So, person eats the food, stomach converts that into glucose, okay? And then when it enters the bloodstream, the pancreas down there underneath releases its insulin, okay? And what that's going to do is it's going to drive the glucose into the cells and get it out of the bloodstream. Now, type 1 diabetic just cannot produce, it has not the function to be able to produce enough insulin. They just don't have enough insulin. And because of that, the blood glucose increases in the bloodstream. So, when we think of type 1, we used to think, well, it's usually children's as a heritable disease, is what it is. Type 1 diabetes affects children. Type 2 diabetes was thought to be a later onset and associated with adulthood or older people, okay? And so the same thing kind of happens, you know, the person takes in food and they eat the food and they convert it to glucose and the glucose enters the bloodstream. But the difference between type 1 and type 2, the pancreas is producing lots of insulin. The problem is it is resistant to its effect. The insulin doesn't work to drive the glucose into the cell and get it out of the bloodstream. And so the result is you have high blood sugars again, high blood glucose in your bloodstream again. Now, late onset, that's what we thought. Caused by obesity and lack of exercise? Yeah, we used to think that this would be the old person's diabetes. The main thing is to realize is the body is just a fascinating thing. And what happens is that pancreas' whole job is to maintain your blood sugar at a certain level all during the day, no matter what your exercise is or what you're eating. And with diabetes, they lose that function of being able to control their blood glucose levels. So, why is this high blood sugar even bad? Why do we even worry about it? Well, if it's left under control and the excessive blood glucose levels come so high, the problem is that it causes a weakening of the blood vessels. It causes the last of their elasticity and the ability for them to handle different things that are going on in your body. So diabetics have a higher incidence of heart attacks and stroke because the blood vessels that are associated with diabetics are weaker and they lose their elasticity. The risk is 2 to 4 times higher with people with diabetes. High blood pressure. Without the elasticity associated with those vessels, then what happens is their blood pressure goes up. And 73% of diabetics have high blood pressure. And of course, then there's also blindness. And that's associated with the most leading cause of blindness from 20 to 74 years of age is diabetes. So, why is diabetes bad? Well, we look on the picture here, we can see plaques forming on the inside of an arterial wall associated with the left anterior descending artery, okay? And you see those plaques being there. Well, those plaques form for a lot of different reasons, but diabetics have plaque formation more common. They lose the function for that normal vessels associated with the heart. And so what happens is they actually have an increased chance of having a heart attack. So let's talk about eyes. Have you ever had your eyes checked by a doctor? Well, when they do that, they look in the back of your retina and they look for normal function. That's what they look for. So if we look in our picture here, you can see the normal retina on your left, and you can see the macula, and you can see the optic disc, and you see the normal blood vessels going towards the optic disc. And it's one of those things where that's a normal eye, okay, on a person with normal blood sugars. If you look on the right-hand side, you see retinopathy. Retinopathy is the retinal damage associated with high blood sugars, okay? So you see the hemorrhage, those little spots of white that are where the blood's not getting in anymore, and there's actually causes vision damage. And then you see aneurysms, which is a weakness of the arterial side, and that causes them sometimes to rupture and hemorrhage, and that's what causes the problem. A loss of those cells because they don't get blood cells, they don't get blood supply anymore. So, what does it look like? Well, if you look at the stop sign on the left-hand side, you can see it's nice and clear, and this is for a person who has normal vision. But for the diabetic on the right-hand side, you can see that there's places where you have blurred vision, but also, if you look where the man is, there's a black hole because there's no cells there to transmit that light to the optic nerve so that they can see. And that's what's so important. Diabetes is one of those diseases that has long-term effects associated with those people that have it. One of those is kidney failure. One of the leading causes of kidney failure is diabetes. And you can kind of intuitively think that out because if 1/3 of your cardiac output, every time your heart contracts, beats, sends blood, 33% of it goes to the kidney. Well, if we have weakened vessels, that means the kidney's not getting the blood, and that causes kidney failure. And the problem with that is then you're looking at the long-term effect of kidney damage, which would be dialysis. We look at a picture here, you can see a urine test strip, and they're checking for ketones. So how do ketones get formed? Well, ketones in the urine is associated with, where's the glucose staying? The glucose is staying in the blood supply. It's not getting to cells. So the cells are needing something to eat. So what do? Well, they the body, because the cells are telling they need glucose, starts breaking down proteins and fats. That's what happens. And that causes the production of ketones. And so ketones are not a good thing in the urine because it shows that your body is not getting enough glucose to the cells. Let's talk about diabetic comas. There's two ways a diabetic can end up in a coma. The first one is there's not enough blood glucose for the brain to function. Now, how could that happen? Well, we know what insulin does. Insulin drives the glucose cell, the glucose molecule, into the cell is what it does. So if the diabetic gave too much insulin, it would drive too much of the blood glucose into the cells, and there would not be enough blood glucose level, glucose in the bloodstream, to help the brain function. And that would make the person, first, act confused, and then second, could end up in a coma. So what would a blood sugar be in a person that was in a diabetic coma associated with an insulin overdose? Well, the normal for you and me is 80 to 120. So when that blood glucose gets lower than 60, that's when confusion starts happening, and as it continues to fall, the blood glucose level continues to fall, then what happens is they end up in diabetic coma because the brain cannot function without glucose. The second is if there's too much glucose in the blood. So you think about that. Well, that would be somebody that's not regulating their blood glucose level. So they're not taking their insulin, or they stop taking their insulin, or they forget to give a shot. So what happens on that is the damage we were talking about earlier, that without glucose, the vessels don't work, the nerves get dehydrated, they don't work very well. They also, as excess glucose causes the cell to metabolize differently. We talked about the protein and fat starts getting broken down, and ketones start to be produced. Those are harmful chemicals. And on a diabetic coma, that blood glucose level could be as high as 400 or 500, and even higher than that. So that's the two ways. One is the blood sugar could be very, very low, or it could be extremely high. So let's think about something. You're at the mall, you see somebody passed out, and their friend says, oh, they're a diabetic, and they're passed out on the ground. Which do you give? Do you grab the candy bar that you have and give them the candy bar? Or if your friends has some insulin, do you give them insulin? Which one would you do? Take a minute and let's talk among yourselves and see what you would do. So, what'd you do? See, the problem is you don't know the person's blood glucose level. Unless you can measure the blood glucose level, you can't tell if they need insulin or if they need something to eat. So the best thing to do is get them to the emergency room. Call 911 and get somebody there that can help this person. Mental break number 2. So, what are you going to eat today for breakfast, lunch, and dinner? Okay? Well, I think my breakfast this morning was 3 fried egg sandwiches loaded with cheese, lettuce, tomatoes, fried onions, mayonnaise, 2 cups of coffee, 1 5-egg omelet, 1 bowl of grits, 3 slices of French toast topped with powdered sugar, and 3 chocolate chip pancakes. And then at lunch today, what I'll eat is 1 pound of enriched pasta, 2 large ham and cheese sandwiches with mayo and white bread, energy drinks, and packing with 1,000 calories. And then, of course, tonight, before I go to bed, I'm going to eat 1 pound of pasta and an entire pizza and 2 or 3 more energy drinks. That's what I'm going to eat today. No, that's a lot of food. So, is this the correct diet for somebody? Who would eat that much food? Well, Michael Phelps does. See, he can eat 12,000 calories a day. It's okay because he matches his exercise to his diet. All the exercise that he was doing for the Olympics and getting where he is, he had to have 12,000 calories to make that all happen. Me and you don't need that much calories. Why do you think the prevalence is rapidly increasing in young people today for type 2 diabetes? Well, it's linked to what we eat and how much exercise we get. So, the obesity epidemic is taking over our globe, and that is the direct correlation between obesity and insulin resistance that ends up causing type 2 diabetes. Let's talk about type 2 diabetes and the weight issue. First thing you have to do is you have to find out your BMI, your body mass index. Among people diagnosed with type 2 diabetes, if their BMI is less than 25, it's 15% of the people. Whereas your BMI is between 25 and 30, it's 30%. And the BMI is greater than 30, it's 55%. We know this. Over 85% of the diabetics have a body mass index of over 25. And this is considered overweight, where 55% has a BMI over 30, which is considered obese. So your body mass index is your height and your weight. And those are the two things that determine that. Now we need to be careful with this because there are times, and you can look at weightlifters who have large amount of muscle mass. Their weight is associated with muscle, and that makes a difference. So be careful with your BMI index and understanding that weight, there's good weight and bad weight associated with it. Diet plays such an important part in type 2 diabetes. The treatment and prevention of this type of diabetes is centered around proper diet and good exercise. This can support weight loss, and it actually affects the limits of the disease and impact on your body. So, management of your glucose levels is required also with type 2 diabetes too. And so sometimes you have to go on insulin for a short period of time, or maybe forever. But it's diet and exercise that is used to control type 2 diabetes. Type 1, which is usually associated with not producing enough insulin, all type 1s have to be on some insulin injection. And you see in the picture there that there's insulin and there's a needle there that they give, or you can have a pump. And the insulin pump actually works all day long, and you use this to manage your diabetes because it gives you insulin all day long. So, what are the difference between the two type 1 and type 2 diabetes? What does body mass index measure, and why is it important? And which diabetes is most treatable with diet and exercise? Well, the difference between type 1 and type 2 diabetes is that type 1 is associated with insulin not being produced by the pancreas, where type 2 is associated with lots of insulin, but the insulin is now resistant and is not working, which causes the blood glucose levels to increase. Body mass index is an indicator of where you are in your weight. And that score there is associated with, if you have BMIs that are high, you have an increased risk for diabetes. And lastly, which diabetes is treated most easily as treatable by diet and exercise is, of course, type 2. So, let's move to animals. I'm a veterinarian, and I want to talk about animals now. And that's really important to me that we understand that, animals can have diabetes too. And so it's a growing problem, just like it's a growing problem in our society today about type 2 diabetes. Same thing in dogs and cats. So dogs are more often found to have type 1 diabetes, and cats can either have type 1 or type 2. We know how to tell the difference on those two. But what are the symptoms in dogs? Well, it's basically the same. Sudden weight loss or gain, excessive drinking or urination. Appetite is either excessive or absent. Dogs have eye problems or blurred vision or cataracts, and cataracts is usually what we diagnose. That's what we start looking at diabetes, is because dogs have a sensitivity associated with this, and so they increase the incidence. So if you see a dog with cataracts, that's one of the things you worry about, is are they a diabetic? Cats, on the other side, show weakness is what they show. And so their back legs get weak and wobbly, and they have a kind of a stilted walk associated with it. Also, there can be thinning of the skin. And the main thing to remember is, if you see a dog that's increasing urination, increasing thirst, that would be one of the symptoms that you'd want to tell your veterinarian, because dehydration can cause death associated with these pets. So, how do you treat it? Well, it's just like we do in humans. We treat it just basically the same. There's dogs and cats that are on insulin injections, and there's some that are on special diets and exercise programs. So we treat it just like they do in humans. So the change in diet has come a long way, because now we have, for especially the diabetic animals, we actually have diets that are associated with this, prescription diets. They're low carbohydrate diets that reduce the amount of insulin that's needed and stabilize the sugars in cats and dogs. High fiber, more moderate carbohydrates we use in dogs. So we use both insulin and we also use diet, just like they do in humans. So the cool thing about this is that we have ongoing research associated with diabetes. So in type 1 treatment, we have three of the research models that's going on right now. One is the islet cell encapsulation. And you think about it, you get the insulin-producing islet cells, and you put them in a permeable membrane that protects them against the immune system. Because when we take outside cells of a source and we put them in the diabetic's body or your body or my body, and what happens is the immune system will make them inactive. Well, by coating them with a permeable membrane, that protects them against the immune system that me and you would have that fight these foreign cells. Now, the neat thing is we also have the islet cell regeneration. And what that is involves protein responsible regeneration, and so they're using these cells in pancreases of diabetic type 1 patients to see if they can use this function. And the last thing is the use of stem cell research associated with diabetes. Now, this is the cool thing, is we also have some gene therapy that's out there. We have an oral medication that has a viral vector on it. You have a virus that we actually do some gene manipulation on that contains the insulin gene, and it's digested and ends up in the intestines, and it's used to manage the diabetes through insulin production. These viruses actually trigger insulin production. Prevention-wise, we were thinking about immunization. If you can think, it's the immune system in the type 2 that makes insulin resistance. That if we had a vaccination that would keep down those cells that cause the problem, attacking the beta cells, then that would be pretty cool, and we could do that. So that would be a prevention of type 1. The last thing here on ongoing research is we have a pancreatic beta cell. And that small cell there is what produces the insulin. So if they took that out of a person who has a normally functioning pancreas, and they can put it in a little nanotechnology, a little robot, if you can think about it, and stick it in and get it in a person, that is, that nanotechnology, that small little robot, and you put the cells inside of that, they actually can produce and stay in the body to allow the insulin production to increase, which would help diabetics tremendously. So, when you're understanding diabetes, you got to know the symptoms that are associated with this disease. You have to understand the differences between type 1 and type 2. And you have to understand the prevention and treatment in animals and humans. So, why is this so important? Well, it's really important to me. Because guess what? I'm a diabetic. I want to thank you for your attention for this module, and appreciate your time, and any questions that you could have. The facilitator there in the classroom, your teacher can help you with those things. Appreciate your time, and thank you from the doctor's black bag. Thank you.